This conference will now be recorded.
So you are welcome to the Part 3 world. What you can see in front of your eyes, guys, is the cubicle for the face-to-face exam. Okay, so this is how the clinical assessment of knowledge, okay, is delivered. So this is what you expect to see in the face-to-face exam. This is what's called the circuit, okay, and it's on the form of a cubicle, as you can see, okay, and this is 14 tasks for all of you guys, and in the 14 task you will be assessed in different ways. Okay, so they make sure they squeeze you really, okay, and they make sure that you worth to be a member of the Royal College exam. Okay, so as you can see, that's very near to each other. Okay, so people can hear each other. Okay, other people when they are talking or they are performing their station, but don't worry, believe me, the level of your concentration will be so high, so you will not be able actually to blink or to listen to any other. You will be in your own world. Okay, so this is the circuit. Okay, as you can see here, if you can see with me, guys, this is where your task will be. Okay, can you see my arrow? So this is where the task will be written. Okay, you will be required that to have two minutes reading, okay, of the task, and then after the bell ring, you will enter to the cubicle. Okay, there is a copy of the question also will be set on the desk. Okay, so don't worry about the copy. In the face-to-face exam, you are allowed to take notes. Okay, so you will be given a handheld notes and a pencil. So simply you will write down any notes or any important point that you would like to remember about the case, okay, or the information that the patient gave to you, okay, so in order not to forget. Okay, so it will be very useful at the end of your exams they will take from you. Okay, so this is the picture as I show you guys. So let's start our orientation. Important thing about the eligibility, I know that every one of you maybe have been across this. So in the eligibility for the Part 3 exam, of course, number one is that you passed Part 2, obviously. So the second thing that you have to fill is the assessment of training. Okay, so the assessment of training form is very important that you fill it before the Part 3 exam. And my advice to you, don't wait till the last minute. Okay, so whenever you can do it, you do it. It's actually can be, applied to the college from the day you pass Part 1. Okay, and in the past, before 2019, it was a legal requirement before sitting Part 2 exam. Now they make Part 1, then Part 2, then they will check your assessment of training before Part 3 exam. Don't please, okay, wait till the time you book the exam to get your assessment of training clarified from the college or approved. Why? Because sometimes they will return it back to you because of some information are not clear. Okay, I have posted to the group, guys, the most important things, and they wrote on the application. It's a must. So, for example, this must be on the hospital official paper. This cannot be a contract. Okay, and it must show 4 years of the training in the obs and gynecology, okay, and the 4 years of the training, it must be in a hospital as well, and full-time job, not a part-time, or otherwise they will ask you to make it like to continue your experience. Also, you must be working at least 2 years in the last 4 years before you apply in the obstetric and gynecology. Also, you need your consultant or head of department, okay, to sign this as well. So the requirement of the assessment of training is very important. Please fill the assessment of training and make sure you post it to the Royal College to the email given, okay, in the frequently asked question. Here I have kept the link, guys, for you, and I'm also willing to post it on the group. So you go and, you go and please check. If you did it before, even before 2019, you are not required to do it again. So it's something that we will do it once in life. Okay, this is the most important thing about the eligibility criteria. If you are planning to have the MTI training, okay, so also assessment of training is part of the requirement for the MTI training if you would like to see this program and attend the interview. If it is in our country, there is, yeah, I remember there is a special interview, and after you pass this interview, you can have the post in the UK without completing the eMRCOG. So please, assessment of training made some of your friends, unfortunately, were not able to book their exam. So it prevents them from booking the exam in November and also in May last time, same thing. So avoid the unnecessary delay and finish it from now. Okay, so this is the important thing if you are planning to sit the exam in 2023. For the exam dates in 2023, and I know that all of you know that already, that there is an additional time of the exam, which is in February. And in the February, it's 6 to 10 of February 2023. And this is an additional exam date outside the traditional timetable, okay? And this is because of the large number of candidates awaiting to have their place for Part 3 exam. This exam is only for the overseas, not for the UK trainee on the specialty training program, okay? So that will be only overseas exam. Okay, guys, that's very important. Make sure that you know the information that people who sit November exam is not eligible for February, and so as well people who will sit for the February exam not eligible for May exam. Okay, so this is made clear by the college. Okay, so people will attend one of these, but they can't attend November, February, May, like that. Okay, so people who unfortunately not be able to pass in November 2022, they are only allowed to go for May, not February. Okay, so let's see the format of the assessment of the 14 tasks and what they are doing or what they are assessing in you. Okay, so everyone knows that we have 14 tasks in a circuit, and the 14 tasks, there is also 5 domains to be assessed. Okay, so this is patient safety, communication with patient and their relatives, communication with colleague, information gathering, and applied clinical knowledge. And you have to pass, okay, in those modules. It's not necessary that you pass in all modules or get the standard in all modules, okay? If you have achieved the total, the total mark. So some people, for example, they get brilliant mark in the patient communication with patient, communication with colleague, and the information gathering, and for example, applied clinical knowledge, but they did not meet the standard of patient safety. Previously, it was something like, no, if you didn't pass patient safety, so that's mean you will fail all the station or you will fail the exam. Nowadays, it's not the same. Nowadays, it's if your total mark or your total score exceed the pass score, okay, despite of not achieving success in one of the domains, still you can pass. Okay, so this is a very good thing actually, because unfortunately, let's say the pass score was 61, okay, before some people achieved 64, but they didn't meet the standard in one of the domains. Unfortunately, they will still fail the exam. Now this is changed. Okay, so as long as you have the score, it's no matter if you failed one or if you didn't meet the standard in one of the domains. Of course, we don't want to lose any, okay? And we want to have a high score for this exam, and we were working on that. That's why we are here today. So the 2 minutes is for reading, and you have to have or to gain the skill with practice for the 2 minutes reading time and to make it very useful time for you. Okay, and we will have example today of how to think in the 2 minutes. Okay, this is one thing. The 10 minutes is sharp 10 minutes. When the bell ring, you have to enter, okay, the task and start to say hello and introduce yourself and whatever your task. Okay, this will be your time, okay, to finish it. The types of examiners, I'm so sorry to say some basic things that sound that very naive that everyone know this, but I'm sorry to say that not everyone. I'm still having questions from people who have maybe said the exam before and they didn't make it, and still they don't know really what type of assessment they have. So to make it clear, guys, you are expected to see either a clinical examiner, which is RCOG examiner, okay, or a trained lay examiner. And the trained lay examiner is found in 4 of the 14 tasks. And when you see in the task or in the cubicle that there is a lay examiner, believe me, that task will have a heavy assessment of communication skills, communication with the patient, okay? So the lay examiner is sitting there. He is not a doctor at all, but he's watching you and he's assessing you in a way that simply he see your attitude, your way of communication to the patient, your confidence, and your clarity of language. And I mean, in this case, not how fluent you are in the English language, no, the simple language you use when you deal with a patient. So let's imagine that this patient have a very little standard of education. Can you explain something like, for example, OHSS, okay, to a patient who have little education? Can you say that this is ovarian hyperstimulation syndrome? If you say that, that would be considered as medical jargon, and a medical jargon, this is would be considered as failed communication, right? So it will be deducted mark from your communication, and as well as patient safety. You know why? Because if the patient did not understand what you say, so this has affected the patient safety. They don't understand what you have told them and what advices follow that. So guys, this is the most important thing, that you be smart when you see the lay examiner in the cubicle, okay? So please be careful, okay, of your body language, of your spoken language, and your attitude regarding the patient. Lay examiner can be found in the Breaking Bad news station, in the station when there is a conflict, I would say like that, between you and the patient, or a demanding patient, a patient who requesting that's not advised by the guideline. For example, a patient who had twin and she want to deliver at home, okay, or a patient who had a previous scarred uterus, okay, and she want a home delivery, or a patient who have no indication for cesarean section, however she insists to have a cesarean section early, like at 37 weeks, okay, based on maternal request, which is something that I don't think that doctors will in any place in the world will agree for that, but and it's clearly again at the guideline, but you want to avoid a conflict between you and your patient. So you have to master the communication skill and explain to the patient the pros and cons of her choice and what is the alternative and why we will recommend this, okay? And after that, you have to you know, at the end of the day, show her or acknowledge that this is your choice and this is the respect of patient autonomy. Even if you cannot do what the patient wants, you need to show respect. Okay, so this is important things or important principle for the Part 3 exam. The types of task what is the types of tasks? Types of tasks that we have, actually, it's divided into two main categories. It's either simulated patient task or a colleague task. Means that there will be somebody acting as a patient or somebody acting as your colleague. Okay, and they will, according to the scenario, they will ask you about a situation. If it is a simulated colleague, so that's mean most likely teaching station or a colleague in difficulty and want to discuss something with you. So this is the thing of simulated colleague. Structured discussion, this when there is an examiner, a clinical examiner sitting there, like most of the Viva station, and answering you question regarding the case, and you asking you question regarding management of the case, and you answer, and according to the point in his sheet, okay, you are required to fill all the point of answer for this. Okay, so this is the summary of the types of task. I can show you, my friends, here, okay, what do you expect in the face-to-face exam. Okay, so this is example number 1, okay, of a simulated colleague task. Okay, so this lovely doctor standing here, okay, and this is the candidate, okay, the male, this person number 2, and here is the clinical examiner taking notes, person number 3. Okay, and of course, obviously, this is a teaching station and there is a model and all. Okay, so it's most likely teaching station of something of the module of delivery. Then let's see the next one. This is the example of a structured discussion. So a candidate number 1 is sitting here, and this is examiner number 2, and this is the interaction between you and the examiner. So you are all alone with the clinical examiner in the cubicle. The picture number 3, this is show you, number 1 is a candidate. Okay, so this is the person number 1, candidate, sitting here, and number 2 is a role player. She's acting and looks like she's sincerely acting. They have a good acting skills. Number 3 is a clinical examiner, okay, taking notes also and do your assessment. Nowadays you might see something like iPad. Okay, so they are now doing the assessment on iPad in some of the stations. Number 4, okay, this is a lay examiner, and the lay examiner, again, this is someone from the community, not a doctor, but they give them a training for a few days, and they will ask them about their opinion, okay, whether do you like this type of doctor to be your doctor or not, okay, or working in the NHS or not. Okay, so this is the examples. Okay, some people think that when I go to the cubicle, okay, I will be like confused who is the role player, who is the clinical examiner, who is the lay examiner. First of all, if it is a structured discussion, you will have only the examiner in front of you, so easy. One person sitting in a room means that this is the structured discussion. Of course it will be written, but let's say you're not aware of the situation, okay, or your online exam as well, it will be written there, but you will see only one person, so this is the clinical examiner. If you see one person sitting there with handheld notes or the iPad, and someone else is sitting, okay, near to you, so this is mean the one sitting near to you or in front of you, exactly, this is the role player, and the one on the side is the examiner, and you're not required to interact with the examiner in the simulated patient at all. You might find in the practice books that the examiner will give you examination finding. The examiner will hand you the like ultrasound report or something in between the station. This is no longer done or happen in the eMRCOG Part 3 exam. Okay, this is only for the purpose of practice, and it was there in the past, but now not like this. So simply now The examiner is sitting there watching you. You are not required to say anything, even hello, even good morning, okay? The third one as the same. So this is the role player in front of you. This is the candidate, and those people act that they are not there at all, okay? Don't even look at them. Okay, so this is the advice, because there is no marks, and you are required to act like you are in your daily practice, in your daily practice. So this is very important. This one is the interface of the online Osler system. Okay, so it's an application, and this application has been developed during the COVID era, and this is actually by the role players themselves. So I think that the role player found themselves free, and there's no exams. All the exams is postponed because of the or cancelled because of the COVID. So they came up with this nice idea that they have a company develop application for the online system or the online exam, and they call it Osler system. Okay, and here you will see at the Osler system, okay, number one person, this is the candidate, okay, and this is number two, this is when you are already inside the cubicle, this is the role player, and number three, this is the examiner sitting there watching you. Okay, so this is very simple demonstration of the Osler system. However, also I will post on the group a small video introduction of the Osler system. Okay, sorry, and about how is the interface, or what is expected, okay, during the exam. So this is the online, guys. Again, this is the Osler system. Okay, so I don't know, in the next February, that will be a face-to-face exam only, or online only, or hybrid, means that some centers will have the face-to-face, some centers will have the online, okay, because there's no details still published from the college. Okay, so once we have the information, of course, we will publish it in the group as well. Now let's see, guys, the advice of the practice. Okay, so people usually start with the type of practice that they do the simulated patient task. Okay, and the simulated patient task, you will find it's like 9 stations out of 14. You will have a role player act as a patient. Okay, so the role player act as a patient, this is the majority of your station. Okay, and you need to start your practice really by this. Okay, because you are a doctor, you can speak in medical terms freely. So in a structured discussion, you need only to be trained on how to run the discussion and how your answer would be structured answer. Okay, but it's a new experience that you do, a practice with a role player, unless you have a previous exam, or you had another degree, like for example the MRCPI, and you are familiar with the idea of the role player. Okay, so on the internet you will find a lot of courses, colleagues, groups circulating what's called a template. Okay, and a template is not like a key answer for everything. Okay, a template, it's, let's say, it's a guidance. Okay, it's a guidance for you how to structure your counseling station with the patient. Okay, so how to start and how to end, right? Okay, I repeat again, it's just a guidance. Okay, so it is there for you to develop your own way and your own insight of how to run the counseling. Okay, it's not a religious book. Okay, it's not Quran or Bible, if you get my point. Okay, so the template is something that's just there to guide you. Okay, so it's very dangerous that you have template for each case, especially the recalls. Why? Because If the examiner, they are aware, they are everywhere nowadays on the Telegram groups and on the Facebook, and they know what's happening. Okay, if the examiners felt that you are just saying what's written in a Word or a Word document or in a file and just recalling those things, and this is not actual conversation or counseling between you and the patient, that will be very bad. Okay, so this will have a very bad impact on your mark for the exam. So be smart and know what should be covered in each station, and I would say modify or design the template, make it individualized for the station, but don't go like it's a religious book and you have to follow every word as it is. No, it's not like this. So for example, we have a case of a template of fetal medicine. Okay, so let's go through this template together and see how is the discussion, okay, can be there. Fetal medicine is part of the antenatal care module, and this is the module that we have choose to start with in this batch. Okay, so I think it's the most easiest one to start with. So fetal medicine is when there is problem, for example, in the during the pregnancy, for example, a baby with congenital malformation, baby with echogenic bowel, baby with anencephaly. So you will have different, conditions for the fetal medicine, and it's not a must that you find your antenatal care task in the exam in the form of fetal medicine. You can have it as a structured discussion. You can have it as a role play. For example, patient comes for booking visit and ask you information, or a patient comes with other condition like large for gestational age, small for gestational age, whatever. Okay, so this is just one of the template that's made to guide you. Okay, and this is actually the Royal London template. Okay, so you start by introduction, and in the introduction you say who you are. Okay, and you ask the patient to confirm their name and the age of birth and the age or date of birth. Then you set the agenda and purpose of the consultation. And setting agenda or purpose of the consultation is not like I'm going to do this and that, and at the end I would do this and that. Sorry, with all due respect, this is a very wrong approach. Okay, the agenda should be the patient agenda, and the purpose of the consultation, okay, is when you ask the patient, how can I help you today? Or I understand that you are here today, for example, for the booking visit. Okay, so if the patient had any concerns, or the patient had any expectation from this counseling or from this meeting, okay, so the patient need to speak up and say it to you. Okay, and we will call this as open question. Okay, so you need to start with this open question, and starting with the open question means that you understand what is the patient concern, and this is the most important thing. Okay, this is your exam question actually. Is the patient concerned? I'm concerned that my baby is growing large. I'm concerned that I had a drugs, okay, a case of epilepsy, for example, and I'm using drugs and I found myself pregnant, and I'm concerned that this drug harm my baby or cause an anomaly to my baby. Okay, so you understand now that this is the thing that you need to address during the consultation. This is the woman problem, and you have to offer answer or a solution for her problem. Okay, so this is the most important thing from setting the purpose of the consultation. In the history taking, you will check the gestational age, okay, for example, and if this is the first pregnancy, or the patient had a pregnancy before, or if there is a previous pregnancy, and how the pregnancy is going so far. This is like, a question we ask every pregnant woman. If the woman had her screening, tested for the Down syndrome or not yet, according to the gestational age again. if there is any medical problem, if there is any drugs, especially drug allergy as well, okay, and if the patient is aware of the baby sex. Can I apply this for all the cases? Of course not, because some of the cases um, they come to you very early, 7 weeks, for example, or some of the cases they come to you at 35 weeks. Okay, so 35 weeks, I can't ask her about screening of Down syndrome unless the problem is related to the Down syndrome. Okay, so explanation of finding, okay, or the scan after you finish your history. So it's like the first third of your consultation is ended here. Then you start the management. Always start the management by explaining if there is any result or if there is any problem, medical problem, then you need to explain to the patient. Okay, and when you do that in a patient-friendly language, and this is we will learn from the patient information leaflet. Then offer the management, okay, according to the guideline for each case, and then ask the patient if she had any other concern or any other question. Then you need to do those concerns, or you need to answer those concerns, and then you will finish the station. And the closure of the station will be by providing, for example, a leaflet or information, okay, for the patient to read more about the problem, and to set an appointment for further appointment or follow-up appointment. If there is a problem that touches the family, like for example baby with anomalies, okay, so you need to show them that you are happy or you're ready to discuss or to arrange a further meeting with the partner or with the family. And if there is any referrals you want to do for this case, you will do it at the end, okay. And if there is any contact that you need to leave to the patient, also you provide her with the contact. Like for example, we will provide you with a 24 hours number, okay, so you can call us at any time if there is a concern or if there is an emergency. Okay, so this is like a guidance, as I told you. Okay, of course, for each module we will have a guidance template or a theme template, and each case will be tailored according to the nature of the case. This is one example of the antenatal care module. Let's see the case and how we are going to use the time of the 2 minutes, okay, and be smart. Okay, so number one, if you have 2 minutes, you need to know the information given to you. Is it 1 page or 2 pages? If there is any associated report with you or not. If there is report, of course, you need to read the 2 pages and read the report. Sometimes you will have 3 papers, like 1 paper for ultrasound report, 1 paper for investigation, 1 paper for the story itself. Okay, so to make it easy, as we just doing a start or a beginner station, so let's have 1 page, okay, task. In this task, you will see here, this is a simulated patient task. So very important to understand in the exam, which task is it? Is it a structured discussion or a simulated patient? Okay, because the orientation is different, of course. And assessing further information gathering, communication to patient safety, applied clinical knowledge. Please, those lines, okay, so we said first line is important, so you understand is it a structured discussion or a simulated patient. Following line of the domain assessed is not important at all. Okay, why? I'll tell you why. Because no matter, it wouldn't make a difference. You have to fulfill the task, okay, and only waste your time. You are ST5, so this is start your situation awareness. Okay, so now you understand what is the nature of the task. Okay, so let's say I will go my drawing. This is the first thing you will look at. Then next is the situation awareness, who you are and where you are. This is very important. Who you are the ST5 running a routine antenatal clinic. So where you are, I am in the routine antenatal clinic. Does this make a difference? Yes, please. It will make a hell of difference. Why? Sometimes you are the doctor in the hospital, okay, in the postnatal ward, and this patient already you have just finished her cesarean section, okay? So when you go and introduce yourself and confirm the patient name and start your consultation, you can't say something that like because this is the first time we meet each other, or this is the first time I meet you, okay, I need to know more information about you. No, you need to understand this, very important. For example, you are at the gynecology clinic and a woman presented to you with the smear results show that there is severe dyskaryosis and HPV positive. So you are at the gynecology clinic, so means that you need to refer her to the colposcopy clinic, right? Right? So you understand that the whole task is about you discuss with her what is the meaning of result, what is the implication of that you are going to refer her, and what is the expectation after referral, right? But what if you are in the colposcopy clinic? Let's say you discovered you are in the colposcopy clinic late in the station, and the whole station you are keep saying to the role player, I'm going to refer you to the colposcopy clinic. Imagine yourself, okay? Imagine the situation you are in. You will give a very bad impression to the role player, very bad impression to the clinical examiner, because you don't know who you are and where you are, right? So this is very important. And again, if you're not familiar with the UK system, okay, referral system, starting from GB, then going to the secondary care, when the patient is going to the secondary care, and when to go or be referred to a specialist clinic, okay, you need to understand this, please, okay? So very important to understand the situation where you are. You are with your consultant in the routine antenatal clinic. You have been asked to see the next patient whose details are provided below in the referral letter from the GB. So now we understand that the patient came with a referral letter from her GB. This is her first visit. Okay, first visit means that this is the visit that we will ask most of the information to the patient, not a follow-up visit, for example. Okay, so this is the address of the surgery or the GB, so it's not your problem at all. Then let's read the letter. The letter says, "Dear obstetrician, this Nola Heb, would you be kind enough to book this 38-year-old?" So here I need to know patient age, "for antenatal care in your high-risk obstetric antenatal clinic." So why is the GB asking us for high-risk obstetric clinic? Let's see. She is a mother of two, so the patient had 2 kids and just recently found out that she's pregnant. Found out she's pregnant, so means that this is unplanned pregnancy, okay? We are not able to triage her to the midwifery clinic because she doesn't fit the criteria for that clinic, okay? So the GBC that she is a high risk. Why? She had a very high BMI, so this is a problem. Okay, so now you understand that your case of today is obesity in pregnancy, right? So now, and also her age is 38, which is added extra risk in your antenatal care, okay? But the main problem, the main reason for the today visit is the patient had a very high BMI. Have you got my point, guys? Okay, so the very high BMI is the problem. So I, in my mind now, opening the section of obesity in pregnancy, and there is a very useful patient information leaflet as a source of study about obesity, being overweight or in pregnancy. What are the implications for yourself and for the baby? Okay, so you have 10 minutes in which you should obtain detailed and relevant history. So now this is your task. This is your exam question, okay? So if you remember in the past, okay, I don't know if I'm too old or what, but on my days, I used to have these exams maybe in the high school or in the early college days, when they give an account on this and that, or give you a task or a case, and they will give you what is the workup investigation, what is the differential diagnosis, what is the first line of management. Like 3 questions are there, and you need to write down the answer. Okay, so now you need to speak out the answers. This is your questions. So this is what you need to cover in the station. No matter what's written in the information leaflet that I've just said, it's very useful. Yes, it's very useful. But can I just recall it, say everything in it? No. They don't want a recorder in the exam. They want a human being interaction. So this is very important. Shall I say everything in the guideline? Of course, impossible in the 10 minutes to say everything in the guideline. But I need to obtain a detailed and relevant history. So this is antenatal care history. Offer and justify management plan. That's very important. So I need to offer this patient a management plan and to explain to her why we will advise this management. Like, for example, if you are going to start for this woman aspirin, then you need to explain to her why you're starting the aspirin. Okay, what benefit from that? If you are going to offer this woman a low molecular weight heparin, for example, you need to explain why you're offering the blood thinning injection. If you want to start her on high dose of vitamin D, so why? Those comes under the justification of management. Answer any question that the patient may have. So the rest of your question is with the patient. Okay, so that's mean you need to ask the patient about her expectation, about her concern, and in between to ask her if she had any more questions for you, right? So guys, this is your task. Those are the things that you need to look at before you start your 10 minutes. Okay, in the 2 minutes you need to read those. Do you think that 2 minutes are enough? If you know what are you looking for, 2 minutes will be enough. If you're not and you're lost and you're reading every word and try to make sense of the story, no, 2 minutes will never be enough, especially if there is a multiple pages in your task. Clear so far, my friends? Any questions so far? I'll give you some of the example. Good. Okay. I'll give you some example of what should be covered in this task, in the obesity in pregnancy task. Okay, so a good candidate should cover the following points. The following point says, take focused histories that identify high BMI. Okay, so you need to ask her about her weight and height ratio, and family history of obesity, irregular period if she had any before, because she just had her, found herself pregnant. So at least you need to ask her about when was her last menstrual period. This is to help you date the pregnancy. Okay. Of course, those points in the information gathering that you will discover, okay, with the discussion of the patient. Okay, so the patient she have not started on the folic acid yet, so this is something that you need to ask her about. Okay, and this is something we do routinely in the early pregnancy booking cases. If the patient had any special desire, so for example, your patient, so for example, your patient, okay, is having some concerns and she want a home birth, okay, and with your discussion you will just discovered, okay, that the patient had a fear for her children, okay, and you will discover that there is a problem with domestic violence. Okay, so this was one of the cases. I'm just showing you example of the point that need to be covered in the information gathering. So communication with the patient, what's the point of the communication? So the point of the communication, the point of the communication is that you need to introduce yourself and your role and explain the plans of this visit, book ultrasound scan to date the pregnancy, confirm viability, and determine the number of fetuses, need for basic blood, full blood count, blood group, and antibodies, HIV, and others. This is the normal or baseline booking. Screen for aneuploidy. That's also important. Implication of the high BMI for screening. Plan for care including regular visit, sensitivity about smoking and alcohol, screen for the gestational diabetes by OGTT, and discuss about the delivery and where this will occur. Okay, acknowledgement of the issues of alcohol and smoking, okay, because the patient will tell you, okay, in this scenario that she had alcohol and she's drinking alcohol and she's a smoker. Okay, so those are the point. Okay, I will show you in details. This is the examiner score sheet at the end of your task. Okay, so the examiner is going to assess you, okay, in this each domain, how many points you have covered. Okay, of course there is some point that you never miss, and the never miss means that if you miss, unfortunately, you will lose marks. And this is how they give you the scoring. So the scoring for each domain is 0, 1, or 2. 0 is standard is not met. Let's, for example, say information gathering, or standard partially met, okay, 1, then, or the standard is met, so 2. Communication with the family, same thing, 0 or 1 or 2. And finally, they will score each domain for you, okay, and how much have you got for each domain, and the total score for you as well. Okay, so this is the examiner score sheet, okay, and this is how they count the mark for each domain. So you will tell me, Dr. Rabah, there was like 10 points in the communication with colleague, okay, so does this mean that I need to say that all of 10, all of them? I'll tell you, each examiner, he will have a track, okay, I mean that it's like a star for each important point, and if you miss the point with the stars, unfortunately you will miss mark. Other points, okay, that you can miss but it will never affect your score, like a small point. Okay, so let's say, for example, you have a patient like this, obesity, and she had domestic violence. Okay, so what are the important points in the safety of this patient that you need to cover? And if you miss, you will lose marks, let's say. Okay, so for example here, confirm the patient details at the start of the task, ability to triage patient to different pattern of antenatal care. Okay, so she will be a high risk patient, aware of the safety of investigation and therapeutic during pregnancy, aware of issue of the drug and alcohol abuse, domestic violence and safeguarding, has understanding of the clinical governance and risk management, discuss and offer thromboprophylaxis. Okay, so the examiner can have 3 points out of this. Okay, like for example, that the patient had should be booked under the high risk pregnancy. This is 1 point. That you need to address the issues of alcohol abuse and domestic violence and safeguarding for the other children. This would be a big safety point. That you discuss thromboprophylaxis. So 3 points of these will have, like, I'm just showing you example, okay, will have a strike. If you miss one of the 3, you will lose a mark. If you miss 2 of the 3, you will fail. Okay, but other point, okay, you maybe miss without losing any mark. Okay guys, is that clear? Any questions so far? I welcome any questions from you. Okay, guys, so hopefully that you find this information clear for you. Hello, Dr. Judy. Hello, Dr. Sarah. Thank you for your comments, guys, and your interaction. So what is the source to study? The source to study for the Part 3 exam, and I can say it's an open exam. It's an open source exam, of course. But number one, it's a must that you do the patient information leaflet. Is it a must? Yes, it's a must. Is it an option that I finish some and not all of them? No. Why? Because this will give you the language that should be used for your discussion. And moreover, believe me, you will find it that the role player in the exam asking you question that same written in the RCOG patient information leaflet. So that's mean your answer comes from the patient information leaflet. That's very important. Okay, so the language comes from the patient information leaflet. Explanation of some of the point like molar pregnancy, how to explain it, it's there in the patient information leaflet. Answer of some of the patient questions, okay, it will be there in the patient information leaflet because the college simply made this as a guidance for clinician, okay, and how to counsel the patient. So like the guideline, this is the patient information leaflet is your source of study. So is it only the RCOG? In part 2, we had GTG, had NICE, had ISHRI guideline, or we had, for example, the Faculty of Sexual and Reproductive Health. Okay, so it is the same. Yes, it is the same. So, but you will not go for other guidelines, of course. You will revise the patient information leaflet from the Royal College website. Then you will go to the NHS website if you need more about some topics is not covered in the patient information leaflet. Of course, some hospitals in the UK, especially big hospitals, they have their own patient information leaflet, okay, and some of them are very useful for the task. Okay, so of course we provide you with all of the necessary patient information leaflet you need. You don't need to go and search about this and that, being lost with the resources. Okay, so to save your time, everything will be on the channel, okay, of the course. So books to practice. Yeah, those are the 4 books to practice nowadays. So the first book and the most easy book, and believe me, is the most deep one, okay, and very useful, is the Lisa book. And this is recommended by the Royal College, okay? This is recommended as the source of a study. This is very important one. Then you will have task for the Part 3 MRCOG clinical assessment, and this book is brilliantly actually written in a form that 2 candidates or 2 friends will practice together. Okay, so one will be the examiner, or maybe 3. One will be the examiner and one will be the candidate, and they run a structured discussion with guidance to each one of them how to play their role, okay, and what's expected. This is the Oxford, okay? Some people find Oxford a bit like tricky. No, it's not tricky. It's designed for the practice. And again, this is a UK, of course, guidance for the training program. Third book is the Get Through book, okay? And the Get Through book is such an easy book, has 2 circuits, full 2 circuits, and some of the important examples, okay? So I recommend you at the beginning of your revision that you go, or sorry, preparation that you go. And finally, is the complete revision guide for the eMRCOG Part 3 book, okay? And this is the last thing that you do, okay? So first one, and highly recommended, is the Lisa book. Then go to the, maybe get through an Oxford, okay? Those are the three important ones. And lastly, go to the Conji book, because this is the normal sequence, okay, of a study. So you get the very brilliant and very useful advice from the Lisa book, and then you go to the other books, okay, like the Oxford, like the Get Through, and finally get with the Conj. Last thing is the recalls, okay, and the recalls are very important for the Part 3 exam more than any other part. Why? Because some of the cases will not be covered in the books, okay, and you have to practice from the recalls of your friend, okay. Of course, we can't say that the cases 100% will be repeated, no, but just know the topic, or be aware that this topic is important. This topic has been touched before in the exam. Like, for example, a structured discussion of acute kidney injury. Maybe in your daily, practice, you don't meet these cases, or you just refer those cases for the care of other doctor, but you don't deal with them yourself. So when it comes as a structured discussion, you feel like, oh my God, how can I answer this? What to say, what to do? And you will lose your confidence, okay? And that will stress you out in the exam. So by knowing what are the important recalls, you will be able to study or cover those points, okay, well before your exam, okay. Guys, this exam, as I told you, this is the last step before you got your membership, okay. And this exam is a very important exam, okay, that you understand before it, that now it's a higher standard exam, that they have expectations, they have high expectation from the candidates, and you should be, at the level of their standard and expectation. How can we do this together in the group? Okay, so we have choose to divide the the 14 tasks or the 14 modules in 20, okay, sessions, and this is will be along with the final revision. So you can see that we start with the antenatal, and its choice of the antenatal, that's because as I told you, it's easy applicable. It has a template to follow, or a guidance, okay. So we will give you or send you the template for the antenatal cases, also a list with the cases that should be covered in the module, okay. That will be also, you need to read them or prepare them before the next practice session. The maternal medicine module, of course, the maternal medicine is a very wide module from the knowledge point of view. So you will find cases of Crohn's disease, you'll find cases of cardiac problem, you'll find cases of diabetes, find cases of renal problem, and so and so. So actually the cases of the maternal medicine are large number of cases. That's why it's divided into 2 sessions, okay. So at least we will cover like 10 to 20 tasks, okay, from the maternal medicine, either by the group practice or in the live session. The management of labor is the same, okay, because actually we have one module called management of labor, one is the management of delivery, okay. So will be covered over 2 sessions. Postnatal complications, including, for example, postnatal headache, sepsis or infection, postnatal depression, IFD, okay, and counseling after the postnatal, proper contraception. So this will be the postnatal module or problems. Then we will have one separate session for obstetric structure discussion. And in this session, we will focus on the important topics that came before as a structured discussion. The teaching, okay, will be, or the teaching module. You should practice your role as a teacher to your colleague, okay, and this is part of your role as a doctor in the NHS. and in the future as a consultant. So this will be tested in the exam in a separate task. So we will have practice of the most important teaching modules. The clinical governance or the complaint procedure, also this could be a bit tricky for the people who are not practicing in the UK, so this will be covered in one session. Gynecology problem, then sexual and reproductive health, oncology, surgery, post-operative complication, fertility problems, urodynamic. This will be covered each one in a session, except oncology in 2 sessions. Then finally, we will have the gynecology structured discussions, and all the cases that we discussed is based on a previous exam scenarios, and we provide you with the same standard session, okay? So a session that had been touched like them, okay, had been touched before in the exam, and the same standard as the exam. Final mock, that will be just before the exam, okay? Maybe we will reschedule, okay, this timetable, as you can see. So we'll make our final mock at, at January, not February, okay? So maybe 29 and 30, or 28 and 29. So we'll be finished at the end, by the end of the January, including also the mock practice. Any questions so far, my dear friends? Any questions about the sorts of studies? Any questions about anything that looks difficult, or you can be confused in the preparation of the part 3? Yes, requirement of the assessment of training, that's a very good one, okay? So, dear Dr. Ayat, the assessment of training, okay, I will show you how is the form look like exactly, okay, and I'll go through the assessment of training with you, okay. Okay, so this is the assessment of training form, okay, from the college. You will download it from the college website, the same one, okay, and you need to fill and to provide the evidence, okay. So the form, as you can see, will have section of your personal information, and here you need to write the college number, your last name, your first name, and my advice that you do this as the same one you have in your college, okay, subscription, and is the same as your passport, and is the same as your medical graduate certificate, okay. So try to make the 3, okay, of them are the same, okay, otherwise later on you may have some problems in changing your name, okay. So be careful, and if you need to translate any certificate, make sure that the translation is the same as your passport and is the same as your college name, okay. So this is important regarding the name. Of course, your personal information, date of birth, and so then here they advise you that you make sure that your postal and email address are updated. This is your medical qualification, university, medical school name, and date of graduation, medical registration, if you are registered in any, in the UK or outside the UK, okay, so you need to provide them with your registration number with your national medical, council. So according to either in the UK or outside the UK. Then you need to tick the route under which you are applying, okay. Route A, this is for the UK trainee only, and route B for the all other applicants, okay. So if you are outside the UK, you will go for the route B, okay. If you are in the UK but you are not in the training system, then still you will apply by route B. If you are applying to the MTI scheme, then please tick this box, okay, as provided. Then any job that you have, in your career, okay, then you need to write here the job title, how many months you've been practicing this place, the dates from which and to which, okay, and hospital name, consultant in charge, and please make sure that the same person, consultant in charge, is the same person who signed your certificate. I'll tell you something, to be honest, okay. I had my certificate in some place that I worked in that being signed by my supervisor, not by the HOD. Okay, and the HOD is the head of department. Okay, so you think that the head of department is the same consultant in charge. No, try please to write the same person who signed your certificate. Okay, experience certificate enclosed. Okay, so you need to provide the experience certificate. Okay, and again, should have the hospital number, this should be attested copy, and this should be signed by the consultant who were supervising you or was in charge. The general training, pre-registration, if you have any, like for example, the some countries, okay, the internship will be before the council registration, so even this you need to have. Okay, you have provided. Okay, so this is for the route B, for the route B candidate. If you are outside the UK, okay, you need to write, okay, the recognized post registration training. If you have join 2 or 3 jobs, you need to write here. If you are in the same place, also no problem, write one place and write all the details, and this should be fulfilled. Okay, then you need to confirm that anything involved here is correct, okay, and sign. And you need to send for them, okay, a copy of your internship. That's very important, and this should be an attested copy. Of course, again, if it's not in English, you need to provide a translation, and the translation should be attested copy. Copy of your medical registration certificate. That's very important. Certificate or letters confirming each post registration position is stated on the form. So you need to provide certificate. And again, this must, please read the must criteria. To be form from your consultant in charge or chair of the division. B, attested copy, not original. B, an official hospital letter head paper. State the title, nature, and the grade of the post. State the full exact date between which the post was held. Not B, the contract or the appointment letter. Okay? The post to be recognized and approved by the college must be hospital-based experience in obstetric and gynecology, so a private clinic is not acceptable. At least 6 consecutive months duration. So if you have joined, let's say, a hospital for 3 months and left, this will not be counted. Okay, please take care. They will take few weeks, okay, till they review your evidence, and then after that they will say their decision whether it's acceptable and approved or not. Okay, so sending your application, compose a new email, use the subject heading AOT application, insert your college number, attach this completed form and all your combining document, send your email, okay, to that email, that one that's given. You will then receive an automatic response, okay, of the next step. Okay, guys, so this is the important information regarding the assessment of training, and good luck with that. Okay, I hope that this was useful for all of you. Yes, Dr. Nancy, it's in the channel. Okay, I posted to the channel, the course channel, where you find almost all the resources are there to read. Okay, so Dr. Tasrina, you have a question about, shall we revise all the material that we had for part 2? Of course not. Okay, so this is a direct answer, of course not. But let's say you want to revise the management of diabetes. or you want to revise the hypertension, of course, you go back to the material if you need to do this. If you think that you forgot some of the information, if you think that you need to check more of this part, of course, you go for this. Another thing, okay, that some of the information needed for the part 3 or some of the topics needed for part 3 maybe was not at the same important for part 2. Okay, so you will have we will provide you with the resources to read for that. For example, some of the TOG articles maybe was not important for part 2, but it's important for the part 3. Okay, so this way we will tell you in how to do this. Another example, you have a sexual assault case, teaching sexual assault. Shall I go and revise the TOG article of sexual assault? Of course, yes, right? So you might need resources. That's why you will go and revise the material, okay, and make sure that the access in the eMRCOG website is active for the part 2, okay, course. If we need something extra that's not included in details in the part 2, that we will provide you for the part 3 exam, of course, okay. That's why you join a course, right? So you will get rid of all of this headache and focus on the preparation only. Okay, my friends, start from today, please. Okay, reading about the important topic. This is one thing. Another thing, that please try to find a study partner. That will be very useful, because a study partner is going to encourage you in between, and it will be very helpful, okay, to have a role player one time and he will be the role player one time, and vice versa. Okay, so you will both benefit each other. Okay, so, and of course, most preferably that role player, that study partner should be from the same course. At least you both follow the same mentor. Okay, my friends. Okay, so happy studying. And I have a question from Dr. Sarah. Did you say I have to be in practice for the last 2 years, or I didn't understand well? You have to be in practice 2 years of the last 4 years before apply. Okay, so 2 out of the last 4 years. Okay, so Dr. Sarah, I'll tell you something. Okay, if you need any help for the assessment of training application, you can also post, send me a message, and I can help you more. Okay, some of the information may be inappropriate to discuss in public in a recorded session. Okay. Okay, thank you very much. Thank you, everyone. Okay, good luck for your preparation, and I'll see you next week. Okay, I'm going to post a list of the topics that you need to study before the next session, okay, before the practice. So you guys, welcome to the part 3 preparation. All the best.